Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is Michael McGillicuddy. Michael and I will be talking about his classes at the American Massage Conference, Introduction to Kinesio Taping, and Introduction to Pain Management and Sports Massage. But before we get started, let me tell you a little about Michael. Michael McGillicuddy is nationally certified in Therapeutic Massage and Bodywork and is the president of USA Pro Sports, a continuing education company which conducts workshops throughout the world. Michael is also an internationally recognized speaker and has spoken in the U.S., Europe, and Australia. He graduated from the Florida School of Massage Therapy in Gainesville, Florida in 1984 and is now the owner and administrator of the Central Florida School of Massage Therapy in Winter Park, Florida, where he teaches and practices massage therapy. Michael designed and conducts a sports internship program at the University of Central Florida for graduate students of massage therapy. In 1996, Michael was selected as an athlete's medical service volunteer working in the Atlanta Olympic Village Athletic Training Room. He is the past state president of the Florida State Massage Association. Michael is also an international educator and has conducted sports massage and pain management massage trainings throughout the United States. Michael, welcome to the American Massage Conference pre-conference broadcast series. It's wonderful to have the opportunity to talk with you today about your two classes at the American Massage Conference, Introduction to Kinesio Taping and Introduction to Pain Management and Sports Massage.
Well, thanks, Alicia. I'm excited to be here and be a part of the American Massage Conference pre-conference broadcast series, and I'm excited about being able to be in Atlanta and being able to do two different presentations. Both of them, I think that the people that come will really have a good time learning and taking home something that they can really use in their practice immediately.
I'm sure people will get a lot out of your classes, and we're really glad to have you, as I said, on this broadcast. Before we get into your topics, I'd like to ask you why, of course, besides returning to where you worked in the Olympic Village, why did you want to come to Atlanta and be involved with the American Massage Conference?
Well, I really think it's new. I think that you have a lot of some of the top presenters in the United States that are going to present. I know many of them, and I always look forward to having a time to get together with a group of peers, and just to me it's like there's only a few conferences in the United States that really draw a lot of people to them, and I think this conference will be one of those conferences that does that. I think, probably the cost of coming to the conference is so reasonable that I think it would be very attractive to draw new therapists to the conference that may not, have a chance to go to some of the other ones. And it's just a great time to network and meet new friends, and so I'm excited about being there.
Anything in particular that you are looking forward to most at the conference?
Well, again, I just think it's a great time to do the networking stuff. I mean, we're all, presenters and teachers and stuff, but I actually like the social interaction kind of stuff. If there's that Facebook meeting, I want to go to that, the gala. But I really do feel like when you do these social activities outside of the classroom is actually where so much of the wonderful experience is. I mean, don't get me wrong, I love to go in classroom and teach, and I'm sure people are teaching stuff that everybody's going to want to take home, but it's part of that fullness of the experience of being at a conference is to just hang out with people in between classes and get to know people that you don't know, and I really enjoy that about going to conferences.
Well, there will definitely be a lot of opportunities for that at the American Massage Conference, like you mentioned, the Facebook meetup, which is always fun to get to meet people from your social media networking contacts that you maybe haven't ever met before, but you've met them online. And then this event will also have a gala, which is going to be an event to remember from what I have heard. I don't know all the details about it, but I'm definitely looking forward to being there and being at both of them. Really, I'm sure I won't sleep at this conference. There's so much going on and so many great friends that, as you said, we'll all have the chance to catch up with, and new friends that we'll have a chance to make. I think that's one of the best things about conferences is the opportunity to meet new people and to network with people from all over the country and really from all over the world. So as we talk today, I want to remind people that you actually have 2 classes that you're teaching at the American Massage Conference. So we're going to talk about them separately rather than just blending it all in. So first we're going to start with learning about your class, Introduction to Kinesio Taping. I'm really not familiar with this myself, Michael. I mean, I've seen the mannequins at events, and I've seen people with the Kinesio tape on, athletes, and I've heard people talk about it, but I really don't know much about it at all. So can you tell me, why would a massage therapist want to learn about the Kinesio taping method?
Well, the Kinesio tape was invented by Dr. Kinesio, who is a Japanese chiropractor, and it's probably been around for 30 or 40 years, but it wasn't introduced into the world scene until I think when the Olympics were in Korea was the first time Kinesio tape actually made it into the public market to see it work. Athletes have been using it for years in Japan. But what it's all about is Dr. Kinesio did his chiropractic care on patients. But what happens is you can only do so much for a person in the clinical setting, and then you send them home. And if you don't give them something to support the care that you gave them while they spent a brief time with you, it doesn't last very long. So Dr. Kinesio started experimenting with tapes, typical athletic tape and McConnell taping, and he just wasn't getting the kind of support he wanted for his patients. So he came up with Kinesio tape, which is a different kind of tape because it's an elastic tape, meaning when you put it on somebody, it doesn't restrict range of motion and it doesn't bind down the tissue. So people can go through a full range of motion without restriction and pain. And that's basically the big difference. And why a massage therapist would want to know about it is because they're already treating people for all these conditions, whether it's rotator cuff or even a low back issue or a neck problem, which is what our common treatments are. There are protocols for taping the low back and neck, which allows someone to wear this tape for 3 to 5 days. So it extends the period of time, the effectiveness of your treatment for days, whereas if you just do a treatment on someone, it only lasts as long as they feel that, that the effect of that massage. So the biggest thing is that it enhances the effectiveness for a longer period of time, and it takes a few minutes to apply. So it's really a great additional thing to be doing as a massage therapist.
Wow, it sounds like it would end up making you look a lot more professional and effective and make your clients a lot happier.
Definitely, because, again, what I tell people when I'm marketing is that with the economy being the way it is, so many people have had to cut back. And if they don't have to pay for a massage, obviously that's one of the things that they can drop out of their budget. But when they do get a massage, they want it to last as long as it possibly can.
Right.
So a massage therapist that uses Kinesio on top of their massage treatment is going to have that person have the benefit of that treatment extended up to 3 to 5 days, which makes it economically really great for people.
Now, what makes Kinesio tape different than athletic tape?
Well, again, a lot of the tapes that they use in athletics and in physical therapy require you put a pre-tape on someone, and then you use another tape on top of that tape, and it's typically restrictive. If you were ever to go to an athletic training room before football practice, all the guys on the team come in and they sit on tables with their legs extended, and the athletic trainer wraps their ankles. They do a pre-wrap, and then they take the athletic tape, and it's very tightly compressed. Well, if you watch after football practice is over, the first thing those guys do is they go to a bench and cut the tape off their ankles, because it binds down. It actually decreases circulation. It gives you a little bit more support, but it becomes uncomfortable. Where the Kinesio tape is an elastic tape that you can put on while the person's in a full range of motion, and it doesn't compress the tissue like the athletic tape does.
I see. Well, I'll definitely have to get you to tape me at the show in Atlanta, because I have never experienced it, and I've only used athletic tape a couple of times, and I definitely didn't enjoy that at all. So I'm definitely curious. So now I understand that Kinesio tape actually has an impact on the lymphatic system. How does that work?
Well, that's probably one of the major things that Kinesio does. And any massage therapist that's engaged in lymphatic drainage, when they do lymphatic work, it's very light work, because the lymphatic system that we're trying to move fluid through is right underneath the skin. So if a person's doing lymphatic work, they have to gently coax the fluid to go through the lymphatic vessels. If you put very much pressure on somebody, you actually cut off the vessel so the fluid can't move. So the elastic tape, to give you an example, if you're taping in the low back area, you would just take a piece of tape and put it about where their sacrum is and have the person bend forward. When they bend forward, you just peel off the backing of the tape and stick the stretch tape up and down the spine on either side. Now, when you pull the tape backing off, it's stretched onto their skin. So now when that person stands up, if you look at the tape, it creates these little convolutions or little crinkles. Mm-hmm. And what that does is it lifts the skin up. So now that person walking around, every time they make little subtle movements, bending forward and backwards, is actually pumping the lymphatic system. So the tape works by the effect of the skin. The tape's attached to the skin, and as people move their skin, their joints around, it stretches the tape out, and then because it's elastic, it coils back. It does it very gently, because, again, if you press on someone, you will stop the lymphatic fluid moving. So this is a very gentle, massage that can be done constantly without having a therapist standing next to you to do it. It does it automatically by the tape.
Wow, that's really cool. I'm very intrigued. I've kind of looked at it at seeing, as I said, seeing this at conferences and said to myself, well, big deal. What does that really do, or how can it really help? So I'm really learning a lot here. In relation to the muscle system or muscle function, what are the effects there?
Well, this is why you need to be educated in how to use the tape, because it does matter how you put it on. If you don't understand what you're trying to accomplish, you're not likely to get the results. But here's a real simple thing. Dean Juhan wrote a book called Job's Body, and in that book he talks about when human beings are being developed, there's this endomorph, mesomorph, and ectomorph. There's tissue that's being developed as you're a fetus, and the tissue that's being developed at the same time is your skin and your nervous system. As we're evolving, that tissue is developed at the same time. So what that means is that if you put something on someone's skin, it is directly affecting their nervous system. Mm-hmm. So how does that work? There are these maps that doctors use when they want to tell whether your nervous system is functioning well, and they're called dermatones. And they'll run a little wheel on some part of your body. And they're waiting to see if you acknowledge that little wheel or pinprick, you can feel it. And so in your skin, there are these amazing receptors that are sensitive to everything that's going on. It's your way of communicating with the outside world. So if you put tape on someone's skin and you pull it in a certain direction, it will help a muscle contract by that sensation on the skin. If you put tape on the person's skin and pull it in another direction, it will inhibit the muscle from contracting. So you can control whether you're getting a more forceful contraction or you're trying to inhibit a muscle contraction by the direction of application of the tape.
I see. So I know that one of the things you've mentioned to me prior to the interview is that Kinesio tape can help with poor posture, and I'd like to learn about that, but I'm also curious what other indicators or indications, rather, are there for someone to get Kinesio tape treatment in a session?
We mention it a lot in athletics because, the girls at the Chinese Olympic, the girl volleyball players, Carrie Walsh was one of them. She had her shoulder taped when she was playing the matches to win the gold medal. And everybody goes, ooh, what is that stuff? Because they didn't know what it was. They thought, oh, is that a tattoo? What is this stuff that's on her shoulder? But in truth, about 80% of the application of Kinesio has nothing to do with athletics. I have learned how to tape a tendon, tape a ligament. We can work with strengthening a muscle. We can improve posture. There's tapings for how to relieve pain specifically in one area. You can enhance a joint range of motion or restrict the joint range of motion by the way that you apply it. So there's probably thousands, literally thousands of applications for Kinesio. Carpal tunnel, rotator cuff, all of the typical things, piriformis syndrome, all these kind of conditions that massage therapists see people with every day, there is a Kinesio application for it. So
wow.
I don't want people to think it's only for athletics. 80% of the applications are for patients, just everyday people, not really for athletes. But you get the media looking at Olympics and stuff like that, so that's where it stands out. But it's being used by doctors, PTs, OTs, athletic trainers, massage therapists, acupuncturists, across the line to treat all kinds of conditions that their patients have.
Well, what you reminded me of when you said that about people think about this as something for athletes, but I remember in my sports massage training, we were taught that we had traditional athletes, people who are out there training in a particular sport, and then you have everyday athletes who are just average people that maybe they just happen to exercise, or
sure.
maybe they have a physical job, or perhaps they just are in some kind of a repetitive motion type of job or situation. It's not that they're quote unquote an athlete, but that sports massage techniques could still help them.
The wellness market is one of the biggest markets that you could possibly tie into. And people, I try and tell, I always get this because I'm a sports therapist. That's what I've done for 26 years. And all of the students, they'll come to me and go, yeah, I want to work with the Magic, and I want to work with the Yankees, and I want to work. And I go like, well, how are you going to get to work with those people unless you're really good? And where are you going to get really good is working on everyday athletes. you can't just jump out of massage school and work with a $1 million athlete for a professional team. How would you have the skill and the knowledge to be able to do that? So to me, it's like it's really important for therapists to understand that you need to get involved in your local runs and surf tournaments, and we have everything here in Florida. There's probably not a weekend that there is not some kind of physical activity going on here. And if a student really wants to hone their skills, they need people to practice on to get really, really good. I tell them the worst thing you could do is get an appointment to go be the Magic's massage therapist and you not do a good job. You would be humiliated, and it would be defeated. So who do you want to practice on? Hey, practice on your next door neighbor. Hey, practice on that guy that's running the 5K, the 10K, so that when you do get that opportunity to get that super job, you're prepared to do it.
Well, that sounds like some great advice for any therapist, certainly sports massage therapists and people that are working with Kinesio tape. Before we talk about your other class, is there anything else you'd like to add about the Kinesio taping class or advice for therapists that want to do this kind of work?
Well, I think particularly in Kinesio, if you're in the business of really trying to help people, it's just a thing that it's crazy not to add it to what you're doing. It's very inexpensive to do, and it takes a few minutes to do it, and it will help so many people with so many conditions that I wouldn't understand why any massage therapist wouldn't want to learn how to do it. I mean, it's just that simple. And I also think that what you need to know is you're in a competitive market. All massage therapists are competing for customers, clients, and athletes. And the ones that take the time to learn to do the little special things that are extra are the ones that people notice. So it's almost like, learn it, but learn it because it'll make you stand out as one of those outstanding therapists in your community, no matter what the modality is. But in this case, I'm talking about Kinesio.
Well, I think you're absolutely right on that, Michael. And as a marketing educator in our field, I often tell my clients that and students that setting yourself apart is really the way to make a name for yourself and to build your business. And whatever that is, however it is that you can go that extra mile or do something where your clients get a different effect than they've ever had from anyone else, something that works after the session, as you're talking about, or that really makes a noticeable difference that they've never experienced before, those are the things that are going to help you build a clientele, get referrals, make the money you're seeking to make, and be a success in your practice. So I think that's great advice.
Yeah, and the other thing is that when they see it on an Olympic athlete and then you put it on them, you don't think that they don't feel kind of special. It's like, oh, this is that tape I saw on an Olympic athlete. Now I have it on me. They'll go home and tell their family that, they have this Kinesio tape on and stuff. It just, again, all I can say is it's like attending the conference. I try and attend a lot of conferences because when I go back to my community and I start treating the people in my community, I always bring back 2 or 3 things that are new from a conference. So if you go to conferences, you stay up with what's the newest stuff happening and why are these people doing it and how can I help my clients. And that's why when I do these presentations at conferences, I want to do a presentation that someone coming to the conference can learn something that's new and different, and they can take it back to their practice immediately and apply it. So that's my goal when I do the presentations, is not just for me to get up in front of people and tell them how great I am. I want them to go home with something they can use immediately to help them, promote themselves.
I think that's fabulous, and I'm sure that that's a reason why you're a popular educator. Giving people stuff that they can use immediately and not I know we've all been in classes. I don't think there's anyone like this at this particular conference, but we've all been in a class somewhere where we sat there and thought, why am I here?
Exactly.
How is this actually going to help me? And I'm excited to hear your philosophy on that as a fellow educator, but also as a potential attendee in one of your classes. I'm thinking, all right, this is a good class for me to take. So I'm hoping I can make it. One of these conferences we're both at, I'll get in there.
Sure.
So I wanted to ask about your other class because, as I mentioned before, you have two classes at the American Massage Conference. The second one is Introduction to Pain Management and Sports Massage for Lower Extremities. Tell me what this course is about.
Well, I have been a massage therapist for 26 years. From the first month I was in massage school, I took my first sports massage workshop with a person who's famous in this industry named Benny Vaughn. I have studied sports massage for 26 years now, and I study harder now than I ever did when I was in school. But the thing about saying you're a sports massage therapist to the average therapist listening to this, they go, well, I had sports massage when I was in school. So, I learned that pre-event stuff. And I just want people to know that that's only a small part of what sports massage is really, a very small part. So I wanted to combine pain management and sports together because I really think it will draw more people to the class where they might not come if you just said, I'm a sports massage therapist.
Right.
And the thing about this particular class is I'm using multiple modalities. I'm not just going to, it's not just this is plantar fasciitis. I'm going to tell you what it is, how it happens, and I'm going to give you about 5 different things to do for it. I'm using scraping tools, cupping tools, massage, stretching, and exercising, and kinesio taping for each condition. So what I find is that my heart's desire is to make every massage therapist really successful and really get good results with whatever they're doing, because to me, if you're going to be successful, the only way to be successful is to get good results when anybody comes to you with any kind of problem they have. So some massage therapists are just stuck with, I can only use my hands and a bottle of oil. And I just want to show them, no. Our most definitions of massage is manipulation of the soft tissue of the human body, and that can be done by a multimodality approach. And once they realize all of the stuff they can really do to help their clients, it will open up a whole new way of doing business. And you'll be able to help so many more people really get better. Because, see, to me, like if I just have my client lay on a table and I just rub them while they're laying on the table, that's good, but how is that going to help them function later on? And what people want is, they want to be touched. Touch is extremely important. Yes, they want their tissue manipulated, but they want to be able to go to work or get in their car or run down the street and feel good in their body doing it. So the real question is, what kind of modalities can a massage therapy professional offer their clients to really, really, really improve their condition? And that's what really pain management and the sports massage presentation is going to be about.
So I know you mentioned a number of modalities, and I was trying to jot them all down because there were a couple that I wasn't sure. One, you said something about scraping tools, and I thought, okay, I'm going to have to get more details on that. But can you tell me again what the modalities are in this course? And then specifically, I also heard something about cupping. But
yes.
If you could give me just a bullet point definition or a short definition of things. I know we've just talked about the Kinesio tape, but if you could tell me about some of the others.
Scraping tools have been around in the Asian modality. There's a whole thing called gua sha, and they actually took a rice spoon and they scrape people. Now, that can leave people, if you see that gua sha technique with an aggressive Asian practitioner doing it, it almost scares you because sometimes people will get black and blue. It actually can break little capillaries. So I'm not going to scrape someone as aggressively as that. But what happens is every time that you have ever fallen down and had inflammation, a little bit of swelling in your body, you cannot have that condition and not develop scar tissue, because that's the fluid that happens when your tissue gets inflamed is a medium in which scar tissue is laid down. So if you can think about how many times you've fallen, bumped yourself, run into something, and who has ever taken a tool and gently scraped your skin to try and to bring circulation there, to bring more elasticity to the tissue. And again, I go back to Dean Junhan saying that your skin is the outer coating of your brain. We sense everything in our world through our skin because that's the barrier that we live in. And so scraping is this first step in treating soft tissue stuff to prepare the deeper tissue for a treatment that you're going to do. I always use my hands first because if you came to me and said my arm is really sore, well, I don't know how sore your arm is until I try and touch you. When I touch you, I'm going to see how you react to my touch. And
right.
If I know that you're able to take a certain amount of pressure, then I can use the tool. I just wouldn't take out a tool and start scraping your arm or whatever.
Well, I've had that technique done before years ago. It wasn't done for the purpose that you're talking about. It was more about quote-unquote detoxing, I think.
Mm-hmm.
And I can't say I enjoyed it.
Yeah. Well, that's why I'm not doing it to the level that they were
right.
doing it. See, you can take a tool and you can push with 50 pounds of pressure, or you can take a tool and do 3 pounds of pressure. That is going to have a different effect on the tissue that you're applying that pressure to. So to ignore it is not good, but to work too deep that's the caution that you want to have when you're doing it. But if you took anything, you could take a spatula, you could take a spoon, and just gently rub your skin, and you're going to see after you do that, it's going to get a little bit pink or red. And to me, that's what you're bringing blood to that area, and blood brings oxygen and nutrient. So you want to have that happen in certain parts of the body when you don't have good circulation through that part of your body.
I see. Well, that sounds pretty interesting. I'm already imagining myself getting a spatula out of my kitchen when we get off this call, and scraping all the areas where I think I probably have scar tissue. So thank you.
Just remember, don't do it. My thing is, don't do it too aggressively. You just don't want to do it too aggressively because you don't want to cause more damage
right.
than you are helping. Now, once you've done that, then I go in and work on the muscles, and I do the deeper tissue stuff. If there's trigger points, if there's scar tissue, I'll get a little bit more aggressive with that type of tissue that I'm working on. But the cupping now does the exact, where scraping is putting pressure down and compressing and moving the tissue, cupping now is lifting up the tissue. You take a cup, you apply gentle squeeze to the cup, and it starts to lift up your skin. And now remember, where the lymphatic system is right underneath the skin. The lymphatic system is between the skin and the muscles. So if you cup someone and gently lift up their skin, you are promoting this space, a very healthy space between the skin and the muscle that you're working on. So cupping, I just saw an article in one of the magazines, and they showed someone who had foot surgery, and they showed where the stitches were while they were in the foot, and then it showed after 10 treatments of cupping around where the scar tissue was, and the tissue looks so much better. It looks so much more healed and smooth and consistent that's the kind of effect you're really looking for.
Excellent. So then what comes next? We've talked about the scraping tools and the cupping.
Well, my thing is, if you treat trigger points, in the Travell books, they say the last step in treating a trigger point is stretching. Because if you have a muscle that has a trigger point in it, the fibers in that muscle shorten. And so you get rid of the trigger point, but if you don't re-educate the muscle that it needs to go back to its original length, the trigger points will come back. So after you treat someone, you usually want to stretch them. You want to stretch that very tissue that you just worked on, because that will re-educate. It's called neuromuscular re-education. All you're doing is saying, you know, when you laid down here, your muscles were tight and short. Now I've done all this work to you, and I'm trying to let your brain know, hey, you're not stuck in that same pattern you were when you got on my table. Now you have all this new range of motion. Now you have all this freedom of movement. Now you don't have pain in your tissue, so you're going to be able to get up and move much quicker, or with ease of range of motion after being stretched. And then after you stretch someone, they also need to be able to make that muscle contract without pain. So you do a little resistive exercises with them. You know, if it's an ankle, you might do resisted TheraBand, dorsiflexion, and plantar flexion. You just put, you know, muscles need to be able to do three things. They need to be able to stretch without pain. They need to be able to contract without pain. And then there's always an elastic component of muscle, which means if I pulled on you and let go, it would go back to a resting length. All muscle, if you're healthy, all of your muscles need to be able to do those three things: stretch, contract, and maintain their elasticity. And that's what good, healthy muscle is all about. So that's what I'm trying to say is, like, if you just put someone on a massage table and you just rub them and push on them and all that, you're really not having their tissue go through all the things that that tissue really needs to go through in order to function in a healthy way. So it's good to, I'm a massage therapist, so my first thing I'm going to do is massage someone, but that does not help them function on a daily basis. They need to be able to get up and move around and not hurt. And so that's why you add in the stretching and the resisted movements and all that kind of stuff in with your technique. And then I finish off that stuff with Kinesio, because remember, once I've done all this work with you, I want you to keep that work effective. So if I can put a piece of tape on you and leave it there for 3 to 5 days, man, that's powerful.
Wow, it really is. Well, I'm going to have to clone myself so I can be at all the classes I want to go to at the conference.
You're right.
I definitely want to learn more about all of this. And, you know, I can see a number of ways that I think it would be helpful in my own practice. What do you think makes this type of work helpful for therapists in their practice and with their clients?
Well, if you again, I think if most massage therapists go to most of the massage schools, they're basically trained to put someone on a table. You know, they have them fill out a body chart, and the person says, well, my neck hurts. And basically they use a little bit of oil, and they do they do whatever massage techniques they do, but they're really not trained to do all these other modalities. And that's why it's always been my goal to help massage therapists learn as much as they can that's within our scope of practice that will make them successful. And the only way, you know, I've heard many people talk about what it's going to take for massage to be recognized in the world and all that. And I go, look, there's only one way massage is going to get recognized in the world that matters, and that is when massage therapists do really highly effective treatment and get good results. Because that person that you're working on is going to go tell 100 other people, look, when my back got hurt, I went to this massage therapist, and he did this, and this. And you know what? Within a couple of days, I wasn't hurting.
Right.
And that is the most powerful way that we can promote our profession, by getting good results. Now, you can't get good results unless you get educated. And you want to find the best educators you can, and you want to stay on top of what is the most current thing going on. And, and then the other part of it, which is always a part of success, is you have to care about the people you're working on.
Definitely. And I would add to that, when you're talking about results, it's listening to the clients to find out what the results are.
Sure.
I've heard instructor after instructor talk about how important it is to assess your clients and really understand what's going on so you can provide the right solutions for them. And everything that you've talked about today just sounds like more tools that people can have available to them to provide the right solution. And I think that's really exciting.
Yeah, that's why if I was going to name it, it's like the multimodality approach to pain management. Really is kind of what I'm trying to say here. And many massage therapists have no clue about all the wonderful things that they can do for people. So I kind of designed this workshop to open up their eyes to the possibility. This is all the things you have available to you. No, you don't do every technique on every client that comes in. You'll wear them out. You'll hurt them. But these are all available to you as choices to use. And here's why you would use this one. And here's why you would use this one. And here's why you would use this one. And you just become like such a wonderful therapist that people are going to flock to you because A, you know what you're doing, and B, you care about the people you're working on. And massage is a whole lot cheaper than going to the emergency room.
No doubt. No doubt. Well, I know there are going to be some great tools and suggestions and advice that you're going to be sharing in Atlanta, and a number of people are going to sign up for them, but there are some people that won't be able to make it to Atlanta, or perhaps they just want to learn more about what you do now. Can you tell me how people can get in touch with you, or how they can get information about your other classes and programs?
Well, I'm getting ready. It's not quite done yet, but the name of my company is USA Pro Sports, and I'm getting ready to set up a website, USA Pro Sports Massage. So that will be the way that they could best contact me. I also own the Central Florida School of Massage Therapy in Winter Park, Florida, and the web address for that is just simply www.massagetherapy.cc. So Excellent. They can contact me through the school, and I'm really excited. I wrote a book on performance sports massage through human kinetics. That's out now, and I'm actually going to have the website again. It will be USA Pro Sports Massage. That's going to be the website where they can see, where I'm going in the country and where I'll be presenting.
Excellent. Well, I know, and thank you so much for sharing those pieces of information. I know that a lot of people will want to come and see you in Atlanta, so I want to invite everyone who's listening to be a part of the First American Massage Conference and come to Michael's classes. The conference, of course, is put together by Scott Dartnell and his wonderful team, Angie, Monica, Lorna, and Robin. Fantastic group of people, and they've done a tremendous job in putting together a conference that is going to be amazing and a tremendous value. In fact, only $40 gets you access to 25 free one-hour CE classes, access to the trade show that's going to have top massage product and equipment manufacturers and vendors, and you will, through your registration, you'll be eligible to win thousands of dollars in door prizes. And this will be some good stuff, y'all. So make sure to register, if for no other reason for the door prizes, but all the classes and the trade show access makes that $40 investment well worth it. Additionally, that $40 is going to get you access to the first ever National Massage Therapy Job Fair that's going to be held on Sunday the 22nd. And this is not just for people in Atlanta. This is a national massage therapy job fair. So there will be employers on hand from national, state, and local employers. We encourage you to bring your resume. Who knows, that $40 investment might give you access to a new job. Additionally, there will be over 100 hours of continuing education available that you can register for. This is from a variety of instructors, including Michael. These will be 3-hour, full-day, and 2-day workshops. For students at the conference, we'll be offering a free student day, as well as the Smart from the Start presentation and a full-day class with Laura Allen on passing the MBLEX and NCB exams. This is sponsored by ABMP, and the first 70 folks that come to that class will get a free copy of Laura's book that's been donated by Lippincott. Of course, all attendees are invited to come to the Saturday night gala with food, drinks, and live entertainment, so be sure to get your tickets for this event when you register. Again, as I said, this is a very affordable conference. The conference hotel is only $121 a night for your accommodations. Whether you come by yourself or you choose to split this with up to 3 other people, it's really affordable, and that hotel is going to be the place to stay because that's where everything is happening. So I encourage you to get your reservations there as soon as possible. As a reminder to everyone, the show guide will make up the center spread of Massage Today's May issue. This show guide is going out to over 62,000 massage therapists and will be available free at the show. Now, this is the first nationally circulated conference show guide and has some amazing advertising opportunities. So if you're a vendor or educator who's listening in today and you want to get some tremendous exposure for your products or classes, please contact Sandy Pierce. And by the way, it's her birthday today, so happy birthday, Sandy. But please contact Sandy Pierce at Massage Today for details on becoming a part of the show guide. Of course, the American Massage Conference could not happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and Massage Today. We thank all of them for their support in this year's event. Now, if you'd like to find out how you can attend the American Massage Conference May 20th through 22nd in Atlanta, Georgia, and meet Michael, of course, attend his classes and other classes from the amazing presenters at this year's event, you can do it 2 ways. First, you can register and pick your courses by phone for the American Massage Conference. The call is free, and operators are waiting for you. That number is 877-788-3078. I'm going to say that again. So get a pen and write this down. 877-788-3078. Or if you prefer to register online, then just visit the official conference website. That's www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. I hope after today's discussion with Michael McGillicuddy that everyone listening is ready to come to Atlanta and attend his classes, Introduction to Kinesio Taping and Introduction to Pain Management Introduction to Pain Management and Sports Massage. Both very interesting classes, and definitely something I want to come to. I hope I can make my way there. Michael, thank you so much for taking the time to be with me today, and gosh, for sharing all your time and knowledge and your enthusiasm. It's very obvious that you're very well versed in everything you're talking about. So thank you for being here. I'm really looking forward to meeting you in person at the American Massage Conference and hope I get to come to one of your classes.
Well, thank you, and I hope I see you there. And I hope everybody that listened, that you will take the time. Again, I cannot tell you how important it is in your profession to attend the conferences and just meet and network with people in your same business. It's just a wonderful thing to do.
I so agree, Michael. I so agree. Well, thanks again. Everybody else, thank you for being here today. This is Felicia Brown, and on behalf of everyone from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta in May. Thanks again for tuning in today, and have a fabulous day.
Come again.
Let there be plenty, plenty. Let there be plenty love. Let there be